We are now in chapter 36, which means that we are starting the urinary or the renal system. So chapter 36 is going to be on the urinary system function, its assessment, and therapeutic measures. And so the renal and the urinary systems contain useful materials and they excrete foreign or excessive materials and waste. And through these basic functions, they are going to profoundly affect other body systems and the patient's overall health. So I'm going to get to what the kidneys and the body actually does, um, so that you can get a better understanding of why renal and urologic disorders can be so closely linked to other body systems, particularly cardiovascular. So A and P, let's talk a little A and P here. The renal system consists of two kidneys, two ureters, one bladder, and one urethra. And working together, these structures are going to remove waste from the body. They're going to regulate acid-base balance by retaining or excreting hydrogen ions, and they regulate fluid and electrolyte balance. So this is going to be the interior of the kidney. You know, the kidneys are these bean-shaped organs that are highly vascular, okay? So they're located retroperitoneal on either side of the vertebral column. They are basically attached to the vertebral column through muscles, and there's a fat layer that kind of protects them. The renal or the kidneys themselves, they are very, very complex. They have a renal cortex, a renal medulla, there's internal calyces, there's a renal pelvis, as well as the nephron, and that nephron is the kidney's functional unit. So we really look at that nephron as the functional unit of the kidneys. And then here's a picture of what the nephron actually is. Um, the nephron is kind of the main source of what it's the main functioning structural unit of the kidney. That's the best way to put it. Each kidney itself has about 1 million nephrons, and the nephron's two main activities are about reabsorption and secretion of ions and mechanical filtration of fluid, waste, electrolytes, and acids and bases. And while I'm not going to ask you, the specific components of the nephron, understand that there is a glomerulus, there's a Bowman's capsule, there's the loop of Henle, which should sound very familiar when you guys are talking about like your loop diuretics, for example. You've got the convoluted tubules, you have collecting tubules. So the nephron itself is very, very complex. And the reason we're even talking about it here is because when I get to renal disease, for example, the way that we classify renal function or lack thereof is based on how many functioning nephrons that are still remaining within the kidney. So kidney function. So while most of us, when we first start out in nursing or, whatever healthcare related field we're going into, most of us think of kidney function as they form urine. But it's so much more than that. They are responsible for the excretion and conservation of water. They are responsible for electrolyte balance. They are responsible for acid-base balance. So yes, we will go back over acid-base. So where in respiratory, we talked about the respiratory imbalances, this system is going to focus on the metabolic imbalances. So metabolic acidosis, metabolic alkalosis. We also have the activation of vitamin D in the kidneys. You have a production of erythropoietin. So we just wrapped up a chapter on red blood cell disorders. So if you have a kidney function issue, you're also going to have a dysfunction with production of erythropoietin or red blood cell production. And then we also have the production of renin or renin, however you want to pronounce it. So glomerular filtration rate. Glomerular filtration rate, that is the rate at which the glomeruli filter the blood. And normal GFR, according to your textbook, is going to average 100 to 125 mLs per minute. The GFR is going to depend on the permeability of the capillary walls, the vascular pressure, and the filtration pressure itself. I personally don't look at GFR a bunch, but nephrologists, doctors who specifically deal with dialysis, this is something that they definitely look at. So it's how much renal filtrate the kidneys can form within 1 minute. And then here's a picture of glomerular filtration. So basically what you're looking at is the complete removal of a substance from the blood. So that GFR is showing you how they absorb and reabsorb, filtrate. This is not an A&P class, so I do not expect you guys to know every little bit about it, but do understand that this is something that we are looking at within the kidneys themselves. All right, the other parts of the renal system, like I said, that was all just the kidneys. So now we're looking at the other two parts, the other parts, the structures of the renal system. So extending downward from the kidneys, you have the ureters. Those are tubes that act as ducts that channel urine to the bladder through peristaltic waves that occur in about 1 to 5 times per minute. They measure about 10 to 12 inches in adults. They have a diameter of about 2 to 8 millimeters, which will be important when I talk about kidney stones, with the narrowest portion being at the uretopelvic junction. You have the urinary bladder, which is a hollow muscular organ in the pelvis that serves to store urine that's delivered by the ureters. The bladder's capacity is about 500 to 600 mLs in a normal adult, obviously less than children and in elderly patients. And then you have the urethra, which is the small duct that channels urine outside the body from the bladder. It has an exterior opening known as the urinary meatus. In females, the urethra ranges 1 to 2 inches, with the urethral meatus located anteriorly to the vaginal opening. In the male, the urethra is about 8 inches long with the urethral meatus located at the end of the glands. And the male urethra serves as a passageway for semen as well as urine. So normal urine characteristics, okay? So when we're looking at urine itself, we're looking at a couple different things. So like a urinalysis, for example, we're gonna look at the amount. So a normal adult patient should excrete about 1,000 to 2,000 mLs in 24 hours. The color, we want the color to be what they call straw or amber colored. You want it to be clear. And then we're looking at specific gravity, and I think these numbers are off. Normal specific gravity is 1.002 to 1.035. So make sure that that's what your textbook says. Any number lower than the 1.002 is what we call dilute. Anything higher than the 1.035 is what we call concentrated. And so those are things that we're going to look at in terms of urine characteristics. Other components of urine, we look at the pH. Okay, so pH for urine is different for pH for blood. So pH for urine is going to be about 4.6 to 8. And then we look at the makeup. So 95% of urine is water. The remaining 5% are your waste products. So your urea, your creatinine, your uric acid, that makes up the other 5% of urine. All right, and I will do aging in the assessment part.